Janet, you talked about different tests that are being done on watchful waiting patients. Can you tell us a little bit more about that?
So, over time, some of the tests that some of the scientific tests that have been done are evolving. So, especially around patients that have got low risk MDS. So, what I mean by low risk is patients that have got a low risk of their disease evolving into something more aggressive, like leukemia. The research has shown that there are some genes that are mutated within the cells in the bone marrow for low risk patients that may mean that the patient may respond to treatment, or that they may evolve quicker than other patients. So, as a matter of course, in our clinics, we are testing a lot of our patients for this myeloid gene panel. There are 30 plus genes in this myeloid gene panel. Some of them are still of a very scientific nature, so if they're mutated, that means if they're not normal, we still don't understand the full relevance of it. But there are some that are much more common, so we understand that their disease may be more aggressive than maybe the next person who's got low risk MDS, so we may have to keep a closer eye on them, or even change their management plan. Think about something like transplantation earlier than we would other patients. So it's kind of redefining that group of low risk patients. But this is a scientific test, which I stress. So sometimes we still do not understand the relevance of these mutated genes, and sometimes this may cause more anxiety than it answers questions for some patients. So it needs to be done with caution.
And how relevant is that for scientific research overall, to extend the understanding of the disease?
Oh, absolutely. All these samples that we take gathers evidence all the time of what we know is actually a rare disease. The more samples that we have, the bigger a pool of knowledge that we gather, and the more that we can make conclusions from those samples.
And also these patients there might be a clinical trial for them in the future.
Exactly. It may become, the results may become relevant. So even though we may not have a relevance right now for a very rare, some of the rare mutated genes, it may become evident or relevant later on as science catches up.
Okay, thank you.
A lot of the blood transfusion dependent patients, I think they have a lot of anxiety around how many transfusions they're having, how frequently they're having them, and again it's like that watch and wait, but with the blood when they're having the transfusions.
Okay.
And could they be transforming, and then it's doing those regular blood checks on them, and bone marrows to see if they have, and I suppose it's that ongoing anxiety for them, that they find it hard to understand what's going on, and what treatment's available for them at a time when there isn't any available for them in that phase.
So it's a lack of the anxiety around the lack of available treatments whilst still needing transfusions.
Yeah, and patients are quite educated nowadays of like iron overload, with how many transfusions they're having and what impact that has on their other organs.
Okay.